Ugh, a toothache. Is there anything more miserable? It's that unique kind of awful that just takes over your whole world. You can't eat, you can't sleep, you can't think. And when you're stuck in that bubble of pain, what you need more than anything isn't just a painkiller.
Right? Because when every single throb feels like a five-alarm fire going off in your head, what you really need is clarity. You need to know what's going on and, more importantly, what on earth you're supposed to do about it.
Exactly, a clear plan. And that's precisely what we're going to build in this explainer. We're going to create a roadmap to get you from this moment of agony all the way to making sure this never ever happens to you again. So here's our game plan. First, we'll tackle the most urgent question: is this a real emergency? Then we're going to play detective and decode what your pain is actually telling you. We'll find some safe ways to get relief right now, and we'll demystify what happens when you get to the dentist. And finally, we'll map out a prevention strategy so you can leave this all behind. Okay, first things first, not all toothaches are the same, and your very first decision is the most critical one. You have to figure out just how serious this situation is.
All right, take a look at these two columns. This is your triage chart. Everything on the left, that's not just a dental problem anymore, that's a potential medical emergency. We're talking about swelling that's visibly spreading, trouble breathing, a fever. These are huge red flags. If you have any of these symptoms, that's an immediate trip to the ER. Now, the stuff on the right, still incredibly painful, I know, but these are firmly in the dentist's territory. The key here is to get on the phone with your dental clinic right away.
So, you figured out where you need to go. Now, let's listen to the pain itself. You'd be surprised, but the specific way it feels can give you some really powerful clues about what's actually going on in there. Think of this chart as your personal pain translator. For instance, that quick, sharp zing you get from ice cream that vanishes almost immediately, that's often just some exposed dentin. But a deep, relentless, throbbing ache that actually wakes you up at night, that, my friends, is a huge red flag. It likely means the nerve inside your tooth is seriously inflamed. That's a call the dentist now kind of signal. Use these clues to get a better handle on what your body is trying to tell you. All right, so you've made the call to the dentist, but what do you do in the meantime for the next few hours or maybe even until tomorrow morning? Let's talk about some safe and genuinely effective ways to manage the pain at home.
Your best friends while you wait are probably going to be paracetamol or ibuprofen. But there are two golden rules here. One, never ever exceed the maximum dose listed on the box in a 24-hour period. Two, always read the warnings. Ibuprofen, for example, is great because it fights inflammation, but it can be really rough on your stomach, so if you've got a history of ulcers, it's not for you. When in doubt, a quick call to a pharmacist can clear things up.
Now let's bust one of the biggest myths out there. So many people think, if I can just get some antibiotics, it'll go away. But the truth is, most tooth pain comes from inflammation, an angry, swollen nerve trapped inside a hard tooth. That's a physical problem, and it needs a physical fix from a dentist. Pills won't do it. Antibiotics are only for when a bacterial infection actually starts to spread beyond the tooth itself. Beyond painkillers, a few other simple things can make a huge difference. A cold pack on the outside of your cheek, say 10 minutes on, 10 minutes off, is fantastic for numbing the area and reducing swelling. Gentle, warm saltwater rinses can be incredibly soothing for angry gums. And here's a great tip for trying to sleep. Prop your head up on a couple of pillows. It actually reduces the blood pressure in your head and can ease that awful throbbing. But please, never stick an aspirin directly on your tooth or gum. It doesn't help the pain and can cause a nasty chemical burn. Okay, you've survived at home, you've made it to the clinic, and now you're in the chair. For many, this is the most nerve-wracking part. So let's pull back the curtain and demystify the process. Knowing what to expect makes it way less scary. A visit for tooth pain isn't random. It's a very logical, step-by-step process. It starts with assessment. Your dentist will ask you all about the pain and take an x-ray to see what's happening beneath the surface. Step 2 is diagnosis. This is where they might do some little tests, like putting something cold on the tooth or gently tapping it, just to pinpoint the exact culprit. Only then comes step 3. The actual treatment to get you out of pain. And finally, step 4 is the follow-up, where they give you a clear plan for what comes next. See, it's a system designed to get you relief. So, the crisis is managed. You're out of pain. Hallelujah. Now for the most important part. How do we make absolutely sure you never have to feel that way again? The best news is that prevention isn't complicated. It's just about consistency. You've got your daily habits, brushing twice a day with fluoride toothpaste, and, you knew this was coming, cleaning between your teeth. Seriously, floss, little brushes, whatever works for you, just do it. That's your frontline defense. Then you have your long-term strategy, attending your regular checkups so your dentist can spot tiny problems before they explode into a middle-of-the-night emergency. These simple habits are your shield.
So after all of this, from the worst moment of pain to a plan for a pain-free future, it all comes down to this. Your health is built day by day with small, consistent choices. So take a look at this list, think about your own routine, and ask yourself, what's the one change you will make starting today?